Hello, everybody, and welcome. Welcome to our webinar today. I'm going to give everybody a few minutes to get in and settle in and make sure you have a pen and paper handy. I'm excited that you're here. Oh, lots and lots and lots of you are coming on. So while we're waiting for everybody else to filter into the room, I wanted to have you just type into the chat and type in who you are, where you're from, but also type in something like, what are some of the health challenges, at least one of the health challenges that you've been dealing with that seems like you just either aren't making full headway or you've come to a stall, something that you're working on resolving. And how long has that been with you? Has it been with you for a week or two? Has it been with you for a year or two? Has it been with you for a decade or two? I really want to get a sense of this. So as we're going through, I have a sense of where you're at and what kind of things you've done. And if you've done some, dramatic things and changes in your life, that would be something to hear. A lot of times the folks that come to this call, we get a variety of people that come to these calls. Some people are relatively new and are just saying they're fed up with Western medicine not being able to help them, and so they're looking for an alternative. Others have been in the alternative world and been going to summits and taking programs and doing a lot of things, but haven't quite found that one thing, two things, combination of things that are going to do the trick for them. So I want to get some sense of that because you're in for a treat today. As those of you who've been to my webinars before, you know that I like to over-deliver. I like to give you lots and lots of information. So take notes. But the thing is that a lot of times folks don't realize that, just implementing stuff that you've gotten from your free webinars, from your free summits is not enough. So for those of you who are interested in taking this further, I'm going to give you a really special offer to work with me for a full 9 months. So at the end, but that's after I've given you lots and lots of value and information. And if you really feel inclined to move forward, then you can. And if you don't, then I wish you a lot of luck with taking everything I give you because I'm giving you a lot of great information. So I'm going to look and see who's filtering in. Heather from Rio Vista, insulin resistance got me to sweet spot and it's changing. Want to keep the levels that are optimal. Let's see. Husband is interested in fast and how to adapt. Awesome. Tom from Medford, Oregon wants to address prostate cancer. Wow. And stem cells, fasting is great for most cancers, but prostate cancer feeds off androgens over glucose. Yeah, that's true. So there's things, with aromatase inhibitors, and there are natural aromatase inhibitors, etc. Let's see. UK, Favor from UK, and Joni from Illinois, 36 years of IBS. Okay, that should be able to be gotten. There's something that you're missing. There's definitely something from you're missing. Pam says, hello from, I got to guess, huh? Angelica, brain fog and body stiffness are my persistent issues. Lynn from Indianapolis, and Anne, fasting 36 hours twice a week and no weight loss occurring. So there's a missing button there. There's a missing link. And we've worked with a lot of people who have had that issue, and just we figure it out, right? We help you figure it out. Jan from Florida. Yay, I wish I was in Florida. Nice weather, I bet. Hello from Maine, rainy. Okay, this is going too fast for me to keep up with, but I appreciate it. And one of my team members is going to capture all of these for me. And so they'll be in a spreadsheet that I can refer to as we're going through and at the end. So I appreciate you being here. I appreciate you taking the time. I'm going to share my screen and I'm going to do a presentation because I've got a lot of information in the presentation. And at the end, I'll open it up for questions and we can see each other again. Okay, so let me share my screen. Oh, and one more thing before I share my screen. I told people if they couldn't make it live, I would have a dual broadcast on, let's see if I can find it. A dual broadcast on, it's not there. Oh, wait, there it is. A dual broadcast on a phone number. So let me just get that started in case last time nobody showed up. So I didn't do it. But let me do that just so they can hear. I just don't want to say that I've got that available and then not be good on my word. So let me go to one more thing and then we'll get started. So in the meantime, continue to type in what your biggest challenges are. Also, please, 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 and I'll check this when we get to that point in the presentation. I gave you these two assessments, a hormone and gland one and a body system one, which went through digestion and cardiovascular, etc. If you've done them, then go ahead and type into the chat like what your top 3 highest scores were in those areas. And when we get to that point in the presentation, I'm going to explain it and teach you how to make sure you know how to interpret it. And I want to be able to look at those answers. So thank you very much. And team, if you can, Christina, if you can just capture all of those comments from the beginning and all of the comments related to that. I know we'll keep you busy for a little bit, huh? But that'll be important for me later to really customize this for you. And that's what I like to do in my presentations, but also in my presentations, I like to teach you how to customize things for you. And in all of our programs, we spend a lot of time on that personalization because in my opinion, there is no one size fits all. There is no one diet for everybody. There is no one diet for a disease. You know, the medical model is based on this for that. It's based on picking I'm sorry, I'm just a little distracted as I try to find this. It's buried. So it's based on finding the one cure, the one drug, the one procedure that people need to do if they have that. So it's like I'll tell you about that when I start the presentation, but it's not the way it works. It's not the way it works. The way it works is that we're all individual. We all have all kinds of things that go into where we are at this point in time. And where you are at this point in time may be different from where you are at another point in time. And you may need a different diet, a different lifestyle, a different exercise program at a different point in time. Okay, I'm just going to set this up and there it is. And I'll see if I can share my slides with them. I'm not sure if anybody even shows up there, but at least I've got that. Okay, share. All right, so I've got that out of the way. So you've got some good stuff to start on. And let me just begin my slide presentation. And I really want to hone in on that. You are unique. Your genetics, your early childhood development, your mom's condition when she was pregnant with you, like my mom smoked and ate really bad food, just really processed food, that led to who I developed into, how I was as a child, right? Your early childhood exposures, all of that stuff plays a huge role in where your health is now. And sometimes people get really quick results, and sometimes it takes a little bit further digging, right? So it's just, we have to be patient. Okay, so I'm going to go to application window. There we go. So you should start to see my screen and you'll see me down in the corner. I may take myself off in the corner as time goes on because I don't want to block off some of my information. So we're here for what's called the Fasting with Food Ongoing Success. I invited all of you here because you did or signed up for, you may not have actually done, the Fasting with Food challenge that I recently did on Facebook. And we had some amazing results. And it's 5 days. So now what do you do now that you've got some results, or maybe you didn't start it yet? It's okay. We'll just give you a rundown of what you need to be doing ongoing to maintain those changes, to get the changes, to break through those plateaus, like someone just said, you know, been doing all this great stuff, but still weight isn't budging. Like, how do we figure out why these things are happening? One of my favorite words in the English language and in the health realm is why. Why? So we have to really be looking at why. So I'm going to get my slides to advance. So the Fasting with Food 5-Day Challenge just finished. We are renaming the Fasting with Food 5-Day Challenge the next time we do it. And it's probably going to be made into an official program in the early part of 2020, right? I like to say it 2020 rather than 2020. And we're going to rename it. Okay, you ready? Fasting while feasting. And this came to me as I watched everyone post their beautiful pictures of food. And I watched it, I kept saying, wow, this doesn't look like fasting. It looks like feasting. And many of the participants did actually get benefits similar to they would if they were fasting. And they felt satiated. So I thought, wow, they're feasting. They're eating this amazing food. So we will be rebranding it to fasting while feasting. You guys got to be the premier members, the first pass through this. And I wanted to see if it was going to be successful. And I believe based on the results that it was extremely successful. So we were talking a little bit earlier about how medicine tends to come up with a diagnosis. It's like they put you in a box, right? You're Mary, but you have these symptoms. Therefore, you go in this box. And this box is labeled diagnosis, right? Insulin resistance, Crohn's disease, IBS, Alzheimer's, whatever that diagnosis is based on how you present. And then they slap on the treatment, right? So the treatment is generally drugs. Now, if we're in the alternative world, we're in the natural medicine world, the tendency a lot of times is to do the same thing. What should I take for my Crohn's? What should I take for my whatever? And in reality, it's not about what you should take for or what you should do for a particular disease. It's the set of imbalances that are going on in your body that need to be addressed. And that's not what medicine does. They don't look at, oh, there's an imbalance in the absorption of this nutrient. There's an imbalance in, vitamin A. There's an imbalance in this particular hormone. They just look at what's the diagnosis and what's the treatment. And we're looking at you differently because I appreciate you as a unique individual. You're a unique individual and you have the ability to do that. And I realize I didn't do a sound check, so I'm just going to do a quick, make sure everybody's hearing me. I'm looking and I don't see anybody saying they're not hearing me. So I'm assuming you are hearing me. Okay, great. Yeah, you are because you responded to my question. So great. So when we do that, when we address the symptoms and we give it a drug or an herb or a nutrient, we don't really look at what's going on underlying it. It's as if we're pulling out the battery in the smoke detector. The smoke detector is detecting an imbalance in the air, right? The quality of the air. It's detecting smoke in the air. And when you pull the battery out, it stops beeping. Does that mean the smoke went away? No, you suppressed the symptom. And it's similar in the body. You have a pain and you take a painkiller. Does the cause of that pain, the source of that pain, the tissue damage or whatever is going on, actually go away? No, but the symptom does. And we're lulled into a false sense of security. And I don't want that for you. I totally don't want that for you. So the fallacy, I believe in medicine, and I know I'm not saying Western medicine is bad. You have an accident, you have a broken bone, you're bleeding out, you have an emergency. You need Western medicine techniques. That's what they're good at, right? But you don't need it when you're suffering from chronic imbalance symptoms because they have not been taught to deal with it. So what they look at it is you have this disease and they're going to bring you to a place of symptom-free. Disease, symptom-free. It's a dichotomy, two options. Disease or symptom-free. If you're symptom-free, they can't diagnose a disease, can they? Right? There's no way because there's no symptoms to go on. But in reality, there's way more than that. You can go to the point, whoops, my thing won't move. Where did my mouse go? There we go. So what they're missing is that you can be symptom-free, but still have a bunch of imbalances underneath. And there are ways to test you, and there are ways to ask the right questions, and a good functional practitioner can do that. All the people who've been through my nutritional endocrinology training program, my insulin resistance training program, they've been trained to do this kind of analysis, and they can detect imbalances. Okay. And so when we detect your imbalances, you can move you to a state of balance. And when you're balanced, your nutrients are balanced, your digestion is working in a balanced way, your hormones are balanced. And overall, you're not just eliminating the current presenting symptom, you're actually getting yourself to the point of being healthy, being whole, being relatively low risk for any kind of chronic degenerative or debilitating diseases. So we really want to be moving towards the state of balanced, not symptom free. And if you really want to take it to the next level, you want to get to the state of optimal, unstoppable, peak performance, right? Not everybody can get all the way there. Not everybody's willing to do the work to get all the way there. But that's what I want for you. So if you want unstoppable health, type in the chat that you do. If you just want to get into balance, type in the chat. No judgment either way. It does take a lot more work to get to the unstoppable, a lot more commitment. But we can help you to identify your imbalances, get to balanced. And that was the reason I gave you those assessments, to help us identify your imbalances based on symptoms, but also some other things. When we do a complete functional assessment, when I do with people and what I do, my practitioners have been trained to do, we look at your symptoms, we look at your habits, we look at what's going on in your life, we look at your stressors, we look at your nutrients, and we come up with a plan to help you remove that. So if anybody is really wanting to go from imbalanced to balanced at least, and really would like to know what their steps are and have a roadmap to do that, that's personalized, type in the chat that you are wanting that. So this is the result of doing that symptom suppression, disease to symptom-free suppression of symptoms model, right? And if you do it in the house and you pull out the battery, you don't hear that there's a problem anymore. But if there truly was a fire brewing somewhere, it wasn't just a false firing of the alarm. This is what can happen to you. And this is what happens in people's bodies, guys. This is what happens in your body when you just suppress a symptom. Now, symptom suppression is awesome if you need it to get out of enough pain to be able to do the things you need to do. But you need to be, at the same time you're suppressing a symptom, you want to be working on the root cause. Does that make sense? Type in the chat and let me know if it makes sense to get to the root cause. Because this is where you land. This is the medical equivalent of that house burning down. And I've seen too many people I've loved land here. My sister was in there for 2 months. She had a break. They sent her home and then she had to go back and then she died. My brother-in-law was in there for 6 months. And it was so heartbreaking to see him, just this big bulk of a man, just shrink and shrink and shrink until he died, right? And other people I know have been in this situation. A friend of my son's, 14 years old, but developed a cancer in his sinuses. And this is where he ended up. So we all need to take charge. You don't want that for someone you love, but you don't want someone you love to have to deal with that for you. And a lot of times we focus on others, and helping others. You've got to help yourself first, because if you end up there, that's not going to help your loved ones. And it's going to be heartbreaking for your loved ones. So before we go too far and I start to give you some, guidelines and stuff, I just want to reiterate that this is not intended to replace a one-on-one relationship with a qualified healthcare professional. It's not intended as medical advice. It's strictly a sharing from me to you and my experience, my expertise that I've developed over the last 30 years of studying this, and over 27 years of being in clinical practice, doing this, and tens of thousands of patients and clients and students, that I've got some knowledge here. And I want to share that with you as much as possible, because I want you to experience what I've gotten to experience and what I've seen my top clients and patients experience. So if you're on any medication, if you're under the care of a doctor, especially if you're on blood glucose lowering or blood pressure lowering medication, please, please, please check in with the doctor to make sure that what we're doing here, what you're wanting to do here with your diet and lifestyle, is not going to interfere with what they're doing with you. So I want you to stay focused. So to get the most out of the training, I want you to turn off your cell phone and turn off your Facebook. except to invite your friends, because it's very distracting. And I may say something really critically important for you, but you've missed it because you've been typing away. Yesterday, I was watching a replay, fortunately, of something. And it was like, oh, I know, yeah, I wasn't paying that much attention because I knew. And then I heard something and I was busy looking at, checking my mail or whatever. And oh my God, something that was said that was really, really important to me. Fortunately, I was watching a replay and I could rewind. This is not a replay, guys. This is real. I'm here live, in the flesh. And, just turn it off. And if you want to invite your friends before you turn it off, send them to drritamarie.com/fasting with food ongoing. The caps, it can be lower or upper. There's no reason for it to be either one. But drritamarie.com/fasting with food ongoing. Sorry for the long name. I should have made it a shorter name to make it easier for you. Stay focused, right? Stay focused on what we're talking about. Take notes. Have a notepad or your iPad or a computer file, a Google Doc, whatever it is that you prefer to take notes on. And open your mind and heart. Maybe I'm going to say some things that are not that are new to you or that are not within your conventional wisdom. And I want you to be open to that, because it's when we're open to new things, new possibilities, and when our heart is open and we're not judging or saying, oh, that's a stupid thing to do, I can't do that, then you're going to get a lot out of it, and then you're going to see your health improve. So I call this the Fasting with Food Success Formula. It also could be named the Unstoppable Health Success Formula. But because we were just coming off of fasting with food, I wanted to talk about what are the things that you need to do after you've finished the fasting with food and ongoing coming back with it. And to be successful, to really help you overcome these health problems that many of you have typed in that you're having. So this is the body systems and organ assessments that I gave you. And I have printed out copies right here on my desk. Pull them out. And I hope you filled them out. So type into the chat, yes, I filled out the forms, or no, I didn't fill out the forms. Either way, pay attention. If you have filled out the forms, I'm going to show you how to evaluate those scores and determine where the top priorities are for you to get some help. If you haven't filled it out, then I'm going to invite you to take the time after this call to fill it out, but take notes right now on what you're looking for and really record what your imbalanced body systems are. So that's just the first page of each of them. The hormones and glands is about, they're all each about, anywhere from 5 to 7 pages. And the first one is the body systems one. And the body systems one is shorter than the hormones and glands, I believe. It starts with the digestion. And a lot of folks are looking at, I have IBS, or I have leaky gut, or I have diarrhea, or I have constipation. What we're doing is asking you questions to help to categorize how each of the parts of your digestive system are working. Because it's really important not just to address one part, not just to address the large intestine if you have constipation, because constipation can be caused by problems in the upper part of the GI. It also can be caused by problems in the liver. So most people don't think about that. They just think about laxatives and what can I do and colonics and enemas and things like that to help their constipation. But we really want to get to the root cause. So we have categories. We have 2 categories for stomach acid, low and high. Some of the symptoms overlap. Now, you if you're not a health practitioner, maybe not know how to distinguish. That's why we've put them into these categories to see what other symptoms you have. So what I want you to do is go to the bottom. You can see at the bottom of the first page, and you're adding up the columns. And what you're adding up in those columns is the total, not the total number of answers in each column, but the total. So 0 is always going to be 0. It shouldn't even be there, right? Ones, if you have 4 ones, you put in the total down there 4. If you have 4 twos, you put 8. If you have 4 threes, you put 12. Then you're going to add that 4, that 8, and that 12, and you're going to get 24. So you put that in the section that says digestion, section 1, low stomach acid subtotal. Now that's your score for low stomach acid. Then what you're going to do, and I'm sorry about the math, we have an online version of this that we give to people in our programs, but it would take up so much of our computer resources if we gave you that one. It's just too much. It would flood us with email, and there were over 5,000 of you signed up for this this. So we don't want that to happen. So you take that 48, what did I say, no, 24. And in the last one, it says calculate your percentage. And it says the total points is 54. The total possible in this one is 54. 24 divided by 54, you do that on your calculator and you come up with a number. So if I do that on my calculator, let's see, where's my calculator? Okay, so if I do that on my calculator, I do 24 divided by 54 equals 44. Times it by 100, that gives me 44.44%. So that's what you write there, 44%. 44 is a high score. It means you have a lot of imbalance that indicate you might have low stomach acid. So you're going to go through and do this for each of the sections. And then we're going to look at the end. And the very end there tells you what those scores mean. So I would recommend that on that last page, you just do notation of what your scores are in each of those. Like I said, in our programs, we have a whole lot. People that are doing our year-long program or whatever, our 9-month program, they have access to all kinds of forms, and we keep track of all that. We keep track of it. We give them a master tracker, and they mark it in there, and then their coaches or I get on there, and we look at it, and we help you sort through it. But this is a webinar, a free webinar, so we don't have access to all those forms, but I want you to get a way to use this. So what I want you to do is on the last page, just write in the name of each section. You know, there's section 1 is low stomach acid, section 2 is high, and then put your score, your percent score on there. Then you can look at above, there's this green, blue, yellow, orange, red numbers and scoring system. So that one was 44, and it falls into the orange category. And then you read it. That area is very compromised and likely to significantly affect your state of health, well-being, and energy. Our target is to get them all green. I don't know anybody that's ever taken this, except somebody that's like a teacher and has already gone through this, but most people have something that's out of balance. So ideal is green. Think about blue as kind of that, you're on the cusp, it's eroding. You know, let's get some good habits in place, better habits in place. Once you get into yellow, orange, or red, you've got to address these things. You totally need to address these things, okay? So any questions about how to fill that out and how to keep track of all of those cool numbers on that last page? If you have any questions, type them in. And while I'm waiting for you to type them in, I'm going to look at the hormones one and just tell you there are how many sections? There's 10. There's a lot of sections. There's 13 sections. You do the scoring the same. You've got adrenal, but you've got low, you've got high, you've got blood sugar dysregulation. You have several for that. You have thyroid low and high. We've got pituitary. We've got prostate, men only, guys. You don't need to do it if you're a woman. We've got male hormones, males only, female hormones, premenopause and postmenopause, and that's the end. So here's the thing, though, for women, if you are premenopausal, fill out just section 12, which is premenopausal. Don't fill out section 13. If you're already past menopause, fill out section 12 with the way it was before menopause. Like if you had irregular periods and heavy bleeding and blah, 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 go ahead and put that there. And so you get 13 sections, and the same thing, the last page shows you the color scheme, and then you just write down. Now you have this one page, right? This one page that you can look at and you can review to have a summary of where your imbalances lie. And then when you have them like that, you can compare the two pages. And I would say highlight or circle the ones that are highest, the number 1, the number 2, and the number 3. Okay. And we'll talk about that more later when we get to some of the balancing protocols. And but I'd love to hear it if anybody. Christy said her highest numbers are insulin resistance 33, blood sugar fluctuation 44, thyroid 23. Okay, so the top ones would be the insulin resistance, and I lump all of those together into blood sugar. So you have insulin resistance and the blood sugar fluctuation. You have low thyroid and adrenal. Those are the top, and pancreas. So the small intestine, pancreas, so maybe some leaky gut and things like that. So that's good that you gave all 5, because really that adrenal and thyroid are close. But here's the deal. I'm going to I think I forgot to put the picture in. Yeah. So I'm going to stop my slides for just a second so I can explain to you. When you have imbalances, you don't want to just address the presenting place first. So if somebody comes into me and they have hot flashes, I might be tempted to say, oh, there's these herbs you can take and that will help your hot flashes. I want to know why they have hot flashes. And I'm going to go down in what I call my pyramid. So some of you have seen it before. It's my pyramid of, at the base of the pyramid are all the lifestyle factors. There's stress management and sleep and fun and diet and environment and fitness. All of those are the base. We're going to look at that as the cornerstone of keeping your organs and glands in balance. So if you have high numbers in, like you had it in adrenals and pancreas, they were really close. I would say you're going to start with that. But if you had, like, say, a higher number in, let's say, adrenals, and it was higher than your digestion, I'd still start with the digestion and could do things that would help you balance your adrenals at the same time to start to give you relief. Because the digestion is the core of so many imbalances, right? So we have digestion, blood sugar, adrenals, thyroid, sex hormones, and then all the other organ systems. If you don't have proper digestion, you don't have proper blood sugar management, you're not managing your stress well, you're not going to get relief with your thyroid, your sex hormones, or anything else. So we really start with that base, because you're not going to get anywhere with the gut unless you address the blood sugar. And in other people, I'll go the other way. So it's just a matter of personalizing it for you. Put my slides back up. All right. Okay. So let's go through the steps in this formula, because what you've done is you've gone through a 5-day, those of you who've actually participated, what you signed up for and what you've seen is a 5-day process of eating in a way that mimics fasting in the body. So the first step is what we just talked about, which is, oops, go backwards. Where's my backwards arrow? There it is. You want to look at assessing your body systems, and that's with those things we just gave you. Find out where the imbalances lie, so you're not just shooting in the dark and taking supplements and all that. The other thing I want to point out is beyond this paper and pencil assessments are lab testing. A lot of functional docs will just jump right into lab testing. They'll just do a quick assessment and they'll go, let's run this and this and this and this and a whole bunch of them. I don't believe in that. I believe in targeting the assessments to what you need, because it can be expensive and it can be overwhelming getting the results. Plus, if you're coming in with a lot of imbalance, we need to start working on the core first. But I want you to know that there's normal ranges and there's ideal ranges. And when you go to your doctor, if you have an allopathic conventional MD, they'll run your labs and they'll tell you you're either good or bad or out of range or low or high. Those are the normal lab ranges. And those are not very accurate if you really want to be in optimal health. They're basically averages that take into account approximately, I want to say 90% of the population will fall into the normal ranges, because you have to be pretty sick to fall outside of that. What I like to look at when I look at labs is ideal ranges. So ideal ranges come a lot closer together, and they've been given based on the like assessments of healthy populations, right? Like, where do these people who are optimally healthy fall? So you really want to make sure that when you're looking at labs and the doctor says you're fine, I've had people come in and say, yeah, we did the labs. My doctor said they're fine. I'll look at their labs and guess what? I'm going to see so many things that the doctor missed. I'm going to see nutrient imbalances, some digestive issues, potential adrenal issues, immune system, things that we want to follow up with more specific tests. So nobody realizes how valuable and how many gems are in their normal just go to the doctor and get your labs tested thing. So when you stay till the end, I'm going to give you a link to a chart that lists all the different assessments that you can do for each level. And I'll show you that. And this is the picture of the pyramid that I was talking about. Let me see if I can get that to move. There you go. So this is my pyramid. And we really need to address digestion, blood sugar, adrenal, thyroid, sex hormones in that order. Because if you just start addressing thyroid, which a lot of you are probably on Synthroid or Naturethroid or something like that, and the doctor, looked at you, yeah, you have high level of symptoms of thyroid. They went and put you on a thyroid medication before making sure your digestion, your blood sugar, adrenals were all working properly and making sure that your diet and your lifestyle. I'll tell you, I see this all the time. I've had people come to me being on various medications for a very long time and not really getting anywhere because they're not addressing the root cause. The root cause is generally not your thyroid just decides to malfunction. It's malfunctioning because of imbalances in insulin and blood sugar and digestion and some of the imbalances that foretells. So this thing, you're going to get a picture of this and a picture that you can print out. You can laminate if you want. So let's look at the next piece. Connect to your why. An interesting story about that. I have people connect to the why. Why do you want to get healthy? Why did you come to this webinar today? Why are you spending your time on a beautiful Friday afternoon here in Austin anyway, when you could be doing something else? Because you care about your health. But why do you want to get healthy? And when you don't stay connected to your why, you're not always willing to do all the things it takes to actually get the results that you want. So an interesting story, and I call it the why in the sky. Why do you have these symptoms? Why do you want to get well? And one of our participants in our inner circle, our year-long program, we were on a call last night with just a small group of us, and he said, when I first introduced this concept of find your why, he thought it was like woo-woo stuff, but he played along. And now he goes back to his why every time there's a temptation. Every time he, is lured in a direction that's not in the direction of where he wants to go. And I thought that was really, really poignant. It was a moment that really made me smile because some people, I do this thing because we have all kinds of exercises and we have these various things and we include them in our body balance program and in our ERC program. And some of you have done them in the sweet spot program because I think it's an important start for everything. So my why is I want to be full of energy to be able to relate and help people like you and others like you who are struggling with their health. My why is that I lost family members and I don't want to see you having that pain, but also I want to keep myself healthy to be there. This is the last picture of my family together, like all my siblings, and we have 2 nieces and nephews. Now there's 17 of them, but at that time we're 2. This was about 4 years before my mom died. Here she is. Like she doesn't look like she's on the brink of death, but there were all these imbalances brewing in her body that no one was picking up because her lab tests were normal. And my dad died 2 years after her. She was 56 when she died, so she was about 52 in this picture. My dad died at 64, so he was about 58. So he was 58 and she was 56. No, she was 52. Yeah. Anyway, so they died 6 years after that for him and 4 years after this for her. And that was really sad. It was devastating to us. At the time, my sister here, this is Debbie, she was about 13. And my mom, she has Down syndrome. So my mom was her primary caretaker and like her advocate, going into the schools and making sure she got all the services she needed. And so my dad had to take that over and, it wasn't really within his let's just say his skill set to do it as well as my mom. And then 2 years later, he died. And now we needed somebody to take care of Debbie, who's still a minor, a teenager, and had no parents. Like leaving a child, a teenager without parents, if ever you've lost your parents in that age or know somebody, it's really challenging. And my brother here, he's my youngest brother. He was, I guess he was 18 or 19 when my mom died. Or no, he was 18 when my mom was 20. I don't remember exactly, but he was in his late teens. It was devastating to him. I spoke to him just a couple months ago. We were talking about that, and he said he still feels pain about that. Like he felt like he got gypped of having parents to be there during these tender, really difficult years, as you know, that transition from childhood and adolescence into adulthood. So the reason I show you this picture is that the pain that this caused our family to lose my parents was intense. And I don't want anybody to feel that. I don't want somebody to feel that about me. I don't want my kids to be like, my mom didn't take care of herself and now she's dead and she's not here for me and I feel gypped. That I don't want that. Like when he was about the same age when my father died as my youngest son is, maybe he's a little younger. And I think about how devastating that would be. That makes me choke up for my son to lose one of his parents at this point, right? So I do this because I don't want others to experience this pain. I'm passionate about this. And it was the silent killers. That's the thing with my parents. They didn't have diagnoses of heart disease. They didn't have diagnoses of diabetes. They didn't have diagnoses of anything. Their lab tests looked normal. They, got a clean bill of health from their doctor, but they died suddenly. So there was definitely heart disease going on, but they weren't testing it properly. And that's why I'm so passionate about helping you to get the habits in order and make sure you're testing properly. This is my sister, Kathy. She died, I don't know, maybe it was 8 years later, 10 years later. She was 44 when she died. And she became the caretaker for Debbie. They were very close growing up, and she became the caretaker, the guardian for Debbie. And then she died. So poor Debbie got left by 3 parents, right? My mom, my dad, and then her surrogate mom, Kathy. So this kid has been through a lot, and that's not fair to people. We need to do what we can. Of course, you can't prevent unexpected death. You can't prevent, getting run over by a truck or whatever. But there's so many things you can prevent by taking the right actions, getting the right guidance, having mentorship, having education, and having somebody to help you personalize. So that's my big why. I don't want anybody suffering like that. And I just threw this picture in because this is my mom just 3 weeks before she died. They were celebrating St. Patrick's Day. She was 56, drinking green beer, having their fun little bantering. And 3 weeks later, on my 35th birthday, she died suddenly out of the blue. This is me at the exact same age as she was, 56 and 4 months. This was me sending my older son, Eric, off to college. He's now graduated. He graduated grad school. He's looking for a job. He's made it way farther than that. He looks like a little kid in that picture. Gives me tears again. Everything gives me tears. But we were the same age. I'm not from a vain point, but I think I look a whole lot younger than she does in that picture, right? Because I've made choices that were different than the choices she made, right? You could see neither of them were obese. They maybe had a little bit of belly, but my mom had 9 kids. For God's sake, she's going to have a belly. But other than that, they were not, out of shape per se. But it was a lot of the things that got out of balance in their bodies that led to their death. And that's why I do what I do now. This is my latest picture of my 2 boys together. It's the last time they actually saw each other was 6 months ago. They're going to see each other next week because he's coming into town. So I do it because I love these kids. I want to be around for them. I want to be their mentors and guides and the person that they can go to for as long as I possibly can. I want to see them have kids. I want to see their kids have kids. I want to see them into a ripe old age. And that's why I do what I do. And that's what I want for any of you that want it. And so that was step 2. Step 3 is mindfulness practices. Manage that stress, because stress is the biggest killer. Stress, sympathetic dominance, that's the nervous system, sympathetic, parasympathetic. And sympathetic is fight, flight. Parasympathetic is rest, digest, heal, detox. And when we're in the sympathetic too much, it's a strain on our system. So learning techniques to do that, manage your stress, super important for you. Hydration is another thing in my success formula. And people say, oh, you're going to tell me to drink water. Everybody tells me to drink water. But are you doing it? You know, it's so interesting that people will be a few months into a program and they're going, but I still have this and my skin is still dry and I still have, and they're like, how much water are you drinking? And a lot of them are not drinking what they should be. And they're like, I do it as much as I can. Don't make light of this one, guys. Drinking water is super important. Your cells need hydration. Your systems need hydration. You need to have water to detoxify, right? The solution to pollution is dilution. You need to do this. And so half your body weight in fluid ounces, write this down. Plus, if you're sweating because you're outside in the Texas heat in the summer, or you're working out, 8 ounces additional for every 15 minutes you sweat. Okay, so just at least do that. Put your water in glass jars. 2 of these is my goal. I have already had one today, and I'm almost down to the second one. But I put these in my room. I measure out the water that I need to have, and I have it handy. Right? Make it easy for yourself. Okay. Next is get outside. Vitamin D is important. Even in the winter, you're not going to get a lot of vitamin D because the sun isn't direct enough, and especially if you live in Canada or in the northern states. But the sun that is so important for your health, for overall. So if you're in a northern climate and you're not out during the winter, you need to supplement your vitamin D, please. Get it tested, see where it's at. But get outdoors, the fresh air. We live in these boxes with EMF fields around us, with outgassing from paint and the fiberboard in the ceilings and whatever else is around you. You need to get outside and crack your windows a little bit every day just to get fresh air. Even in the winter, we crack our windows. And then the other one on here is sleep. Sleep is super important. And I know you hear this a lot. Oh, yeah, she's telling me to sleep. Oh, there's nothing new here. Sleep is super important. If you're not sleeping because you don't think it's important and you're only getting in bed for a certain number of hours, or you're having trouble sleeping, look at a book called Why We Sleep. It really changed my attitude about sleep. I was like, that's for everybody else, but I take care of myself. I don't need sleep. Yeah, that's not true. So back to this formula, the assess your body, connect to your why, transform your stress, drink your water, half your body weight in fluid ounces, plus 8 ounces for every 15. Get out in the sun, get your vitamin D tested, take vitamin D if you're low, or if you live in a northern climate where you know you're not going to get much, and keep your windows cracked to get fresh air, and go to bed. 7 to 8 hours, 8 to 9 is really the optimal, but at least get 7 to 8 hours of sleep. So these are the things that, yeah, you can do a fast every now and then, and you can do the fasting with food, fasting while feasting, but you need to have these other things in place. And movement is so critical. Movement's critical for your mental health. Movement's critical for your immune system. And I'm calling it movement versus exercise because people go, exercise, I need to exercise. Movement, fun movement that's going to help you to be strong and to be able to keep your balance and not get frail and need a walker. These are the things that are super important. Okay, so greens. Drink your greens, eat your greens, stir fry your greens, steam your greens, blend your greens, make soup with your greens. But greens are so power packed with nutrition that you're going to meet so many of your daily requirements of nutrients when you do more greens. If you're one of these folks that are like, oh, I can't eat them because I have oxalate sensitivity, etc., you need to balance your gut because your gut's probably a mess, and that's why you're not tolerating your greens. And that's the stuff that we can work on. Work on your gut if that's the problem, if you can't tolerate greens. And then, clean it up, clean up the environment, get the toxins out, right? Avoid toxic exposures. They're all around us. I thought this was a funny picture, but they are all around us. They're in our food, they're in our water, they're in the air, they're in the materials in our house, they're in the carpets. Toxins surround us. And you need to be able to avoid as much as possible and then have things in place to help you detoxify. And that's where fasting with food every, month or two or quarter, whatever works well for you, helps you. Personally, I do a 5-day water fast every, month or two. And I'm going to start alternating it with the fasting while feasting so I can do that with others. And then elimination diet. Super important to figure out what you're sensitive to. Doesn't mean you're always going to be sensitive to it, but we want to get those things out, identify them and get them out so that they're not aggravating your system, right? And then a process of retesting. And I teach that in my programs. So fasting with food, all of those things we talked about already, the assess, the why, the transform stress, the drink your water, get out in the sun, go to bed, and get moving. And green it up as much as you can. Lots of great recipes on our blog, lots of great recipes if you're in our Vital community. I do a lot of Facebook Lives. I'm going to be doing more. Reduce your toxic load, right? Reduce as much as possible. Do an elimination diet. And then we're going to go and talk about fasting in a bit. But before we do that, I just wanted to say I didn't say as much as I wanted to about the transforming stress, but it doesn't have to be an hour a day of meditation or yoga or whatever. I wasn't doing it for a long time. I wanted so badly to meditate, but I wasn't able to because I just couldn't find an hour here and an hour there that wasn't right before I slept. There was all these rules. And when I discovered heart math, it changed everything. So I could do these little mini stress transformation breaks. In fact, I do want to do one now. Okay. So take your right hand, put it over your heart. Take your left hand, either put it over your right hand or put it over your belly, whichever feels more comfortable. I tend to like to put both of them over my heart. And take a long, slow, deep breath in, maybe to the count of 7 or 8. Hold it for a few seconds. And then let it out. Again, to the count of 8 or 10. And then do it again. And next time as you breathe in, I want to breathe in the feeling of gratitude. I want you to call to mind some person, place, adventure you had, vacation you had, something for which you feel really good and you have gratitude. And just breathe that in. So go ahead and do that. Okay. We did basically 3 or 4 breaths. That was a short version. It changes things dramatically. So if in the middle of your day, your boss just gave you a new project to finish, or you are the boss and you've got this deadline to meet, just take a few seconds, 3 or 4 breaths. And we teach, a whole method of doing it that's more advanced, but that's enough. And I want you to type into the chat and let me know, did you feel different when you did that? What did you think about? For me, I went to the beach. That's my favorite place, is the beach. Okay, so elimination diet, we did all those. Now we're going to talk about fasting. So we talked about, eliminating the toxic load. Now we're going to talk about do regular fasting is the next one. So regular, not fasting, but cleansing, like do regular cleansing, whatever that is. So the healing power of fasting, after 16 hours, that's not a lot. The body starts to attack the bad cells, and it's a process called autophagy. Like it gobbles up these old cells, and not only does it gobble it up and just eliminate it, it gobbles them up and it uses them as fuel, right? So if you're fasting and you need some fuel, your old junked up cells go. So it's a 2 for the price of 1. And don't worry about the body eating good stuff while you're fasting. It always eats the bad cells and tissues before breaking down any muscle or other tissue, which is why doing a 5-day fast is not going to really get you to break down muscle tissue. This is just a cool picture. So you have autophagy in your mind, kind of like Pac-Man. That we see at the beginning, we have this membrane and it comes and it surrounds the junky stuff. And then it creates this thing called an autophagosome. You don't need to know that. And then it basically moves it and surrounds it and separates it out, and acids are formed in the body, and it eats it, gobbles it up, digests it. It's really cool. So this can be good with intermittent fasting. And if you're up to it, I'd recommend that as a follow-up to fasting with food, where we did recommend intermittent fasting. We actually did time restricted eating. We told you to try to eat within an 8 to 10 hour window. And that helps your body to be in the fasting state more often. But you can also do something called alternate day fasting, where you do 24-hour fast, and then you do a day of eating, and then you do 24-hour fast. And what it means is you're not ever having a day where you don't eat at all. So if on Tuesday you eat regularly, and then on Wednesday you don't eat again until dinner, that's a 24-hour fast, and that would count as alternate day. And then the next day you go ahead and you eat again normally the whole day, and then the next day you just skip. You can do it that way. You can do it like 1 or 2 days a week that you do that. Either any of these are going to give you an ongoing detox and cleanse. That's pretty easy to do. And then variation is important. People say, can I just stay on this forever? Like they asked about the diet, the fasting with food. No, you can't. Because when you lower your calories like that for a long term, your body is going to downregulate. It's going to get used to that, and it's going to slow everything down. And your metabolism slows down, and your fat burning slows down, and you stall. You don't want to do that. So keep your body guessing. That's why alternate day fasting, and then vary with a feast day. So maybe 1 day a week, you take a feast day. So if you're eating a low glycemic and you're doing time restricted eating, maybe on that day you eat 3 good full meals, maybe with a little bit more carbohydrate, like in whole grains, or starches like sweet potatoes or pumpkin or something like that. And you maybe, or fruit, right? So you have these feast days, not eating Cheetos and M&Ms, you know what I mean? But eating more, fun foods within the healthy range. That helps your body to not get adapted and helps you to keep this thing going. Here's my time restricted eating guidelines. If you went through the fasting with food, you did this with me every day in the presentations. We reminded you. Meal 1, meal 2, meal 3. 3 meals a day. Limit no more than 3 meals. We like to optimally space them 4 to 6 hours apart. Meal 1, breakfast. Some people do really well with breakfast. So make meal 1 breakfast. Some people don't. I don't. I skip it. I usually don't eat my first meal until noon at the earliest, between noon and 2 generally. Meal 2, you can call it lunch. Might be your dinner. Maybe you only do 2 meals a day. I like to do the 2 meal a day plan. Meal 3, that's optional. So some people do really well and can still do an 8-hour feeding window by eating breakfast, lunch, and dinner. So breakfast at 9 and lunch at 1 and then dinner at 5. Done, right? And that's within that 8-hour eating window. So figure it out for yourself, because it's very important to find out what you do best on. I was talking to a friend today and she says, I absolutely need breakfast. I absolutely don't need breakfast. So you find out what you need, play with both ways. And then no snacking, no grazing, nothing between meals. So time it. Okay, I finished eating. Like for me, I ate my lunch and I finished, it was a green smoothie. I still have the remnants here. I finished it, let's see, probably right before this thing started. So maybe 1:45. And so 1:45 plus at least 4 is what? That's 5:45, right? 1 plus 4 is 5. So the earliest I should eat my next meal is 5:45, right? So I just keep that fasting going on in my body, let it digest the meal, and also let it, do some of the autophagy. And then no late night eating, at least 3 hours before you go to bed. Now I'm going to be going out to dinner with friends tonight, and we're going to meet at 7 or 6:30 or something like that. So it's probably going to be a little late, but you have the choice then. I'm not going to not eat with my friends. I'm just going to eat light, and we'll probably eat, it should be fine. We'll probably eat by 7:30 and 7:30 to 8 maybe, and then we'll hang out and so it'll be fine. But figure that out. There's going to be occasions when you don't do that because, you have a celebration and you don't. So, go figure. But don't do that on a regular basis. It's really bad for your hormones. Okay, so next thing with success, all of that, all of the things, assess your body, connect to your why, transform your stress. I'm saying these over and over because I want you to remember them. Drink your water, get out in the sun, go to bed, get moving, green it up, reduce your toxic load, do an elimination diet, schedule regular cleanses. This could be monthly doing your fasting with food. It could be monthly doing a greens only cleanse. We have a green cleanse. It's amazing. People get incredible results. We've had people drop it as much as 13 pounds. That's our winner. But most people somewhere between 5 and 13 pounds by just going on just a greens. That's all they eat all the week is greens. And that's cool. And the fasting with food challenge, right? So you do the fasting with food. I would recommend that once a month, at least initially, once a month, you do it for 5 days. If you start to, get your weight where you want it to be and you're feeling the way you want to, maybe you do it every other month, and then maybe you do it quarterly, right? But it's a good thing to do regular cleansing. Okay. And the way we did it was the first day was about 1,100 calories, which is about 50% of what most people eat on a daily, maybe a little bit more than that. Days 2 to 5, we did 650 to 700. And here's the cool part. Everybody felt satiated. They felt really full after eating their low-calorie meals. They're balanced. They had specific macro and micronutrient ratios. And this is how it was. This is research. This is not something I just pulled out of my head. This was research that showed that the particular macronutrient balances in the particular set of calories would mimic fasting. For some, it might need a little bit more protein, a little less protein, a little more fat, a little less fat, but this is an approximate. So it's low protein, low carbohydrate with no animal-derived products for 5 days. High micronutrient content, 30 to 50% of the RDI. The reason for that, and I will say you're probably going to get higher with the way I did it, because this research was not based on the amount of greens that we incorporated. We incorporate a lot of those really high micronutrient foods. Proteins are from plant sources. 5 cups of cruciferous vegetables. In the recipes I gave you incorporated that. You had, a beautiful soup that contained broccoli and cauliflower and kale. We had salad. We had cauliflower mashed potatoes. We had all kinds of really cool stuff that incorporated the brassicas, the cruciferous vegetables, in fun ways. The onion and garlic and cloves and leeks, that helps with the sulfur. If you have a problem with those, we just say leave that out. Right? Just leave that out, just for extra detox. And then all the water content vegetables, cucumber, squash, and other high water content. Low glycemic fruit at a minimum. We had blueberries in there, right? You find what your own glycemic foods, the ones that keep you steady, by measuring your glucose. And that's another story for, that's a more detailed and the exact ways to do that. We do that in our Sweet Spot blood sugar balancing program. And then for your fats, I'm not a big believer in oils. There's some people I have do oils, the underweight folks, people with some specific therapeutic need, but I like whole food plant-based fats, avocado, nuts, seeds, olives, coconut, all yummy, all delicious, all filling, right? And then herbal teas. And people say, well, I can't eat avocados because I'm sensitive. Well, leave them out. I can't eat walnuts. Leave them out, right? There's enough variation there that you've got to be able to find something in there. Herbal teas are unlimited. Just keep down, no caffeine, but eat the herbal teas, drink the herbal teas. And then if needed, this is usually therapeutically, or somebody who has a difficulty with digestion, or somebody who's underweight, 1 to 2 tablespoons of coconut or MCT oil. Okay, not mandatory. So some of you remember that while you're doing the fasting while feasting, that there are some food supplements that would help to not get you into some of the heavy duty detox symptoms that some people were getting into. So sometimes it's an electrolyte repletion that you need, because there's a lot of water stored in fat, and as you drop fat, you lose some of the electrolytes. So some people need magnesium and other things. Branched chain amino acids for some people, especially if you're an athlete, to get those branched chain amino acids to prevent loss of lean muscle. greens powder to provide micronutrients, especially if you can't eat the volume or you've got some irritation to your gut and you can't eat that volume of fiber. Then adding some of the greens powders like Vitamineral Green. There's some Warrior has one. Amazing Grass has some good ones. If you're sensitive to the wheat grass things, then stay away from the ones that contain wheatgrass. E3 Live. These are all really good ones. Omega-3s, right? You get omega-3s from chia seeds, flax seeds, walnuts, hemp seeds, deep ocean fish, purslane, which is a wild edible green, and algae. Okay, so you want to make sure you have a good source of omega-3s. Some people do this with exogenous ketones, totally not necessary, but some people are they keto adapt very slowly and they want to speed that up. They'll do some exogenous ketones, and we have it in your Fasting with Food booklet. The Designs for Health has one, and Julian Bakery has one. Some of them have caffeine, so be careful on those. Okay, so testing was not mandatory, but was recommended to get a Keto Mojo, and because it tests your glucose and your ketones. Or you can look at the Freestyle Libre, which is a patch that you put on your arm, and it does continuous glucose monitoring. I recently somebody posted and said there was a new breath one for ketone testing. The Keto Mojo is $50, and the strips are very inexpensive. Well, they're a little bit close to $1 each, and we only do it once or twice a day during the cleanse. But this thing was $270. So I was going to buy it just to test it out and see how accurate. But I'm not going to do that at $270. I'd rather just have you buy the inexpensive ketone measurer. Someday they'll have one that doesn't require blood. That's reasonable. You can go to the Keto Mojo site and you can determine what state of autophagy you're in. And a lot of people were calculating this and getting excited. For me, by day 2 of my water fast, I was at a 0.9. So if you see this, less than 1 is you're in the highest therapeutic level, right? Some people got there. I actually got to 0.43 on my 5th day of fasting or 4th day of fasting because my ketones were high at 5.6 and my blood sugar went down to 33. People say, oh my God, how did you do that? It's just the way it is. It works as long as the ketones are high. If you have a blood sugar of 33 and you are a diabetic on insulin, you better get tested quickly or get your sugar up because it can go too low and you can go in a coma. The too low is going to vary from person to person. So don't take my number as like, oh, she got down to 33. That's okay for me. Not necessarily. Okay. So my ketones, I knew my ketones were high enough that 33 was not a problem. It may not be that. And I wasn't jittery. I wasn't lightheaded. I just felt, like if the 4th day of fasting, you're feeling a little loose, a little weak. I worked full week this week in spite of all that. 1 to 3, you're at a high level. 3 to 6, you're in a moderate level. 6 to 9, you're in a very light level. And less than that or higher than that, you're not in ketosis. So this is a good way to do it. You're going to take your glucose reading. If you're in the States, you have to divide it by 18. If you're European or Canadian, you don't. And then you divide it by the ketone reading. So for me, my ketones were 5.6 and my glucose was 33. So my number was 33 divided by 18 divided by 5.6, and my lowest one was 0.32. I was in a massive state of autophagy. So yeah, was it uncomfortable to fast for 5 days? Sure. But it was worth it to get all that debris cleaned out of my system. So, you may not ever do a full 5-day fast, but with the Fasting with Food, people were getting numbers that were not too far from that. They weren't getting 33s, but some people got into the 50s and 40s. So let's review our formula again, and we're going to look at the next step. So assess, connect to your why, transform your stress, drink your water, get out in the sun, go to bed, keep it moving, green it up, reduce your toxic load, do an elimination diet, do regular cleanses. My recommendation there was to do the Fasting with Food once a month, at least for the first few months, 5 days a month. Schedule it out in advance so you can clear your calendar. But you don't really need too much because you're going to be eating every day and feeling like you're feasting. And, you can do greens, you can do juices, you can do water, whatever that might be. Next step we're going to move into is you need to get your digestion optimized before you can work on your hot flashes or while you're working on your hot flashes, because the digestion is likely to be an underlying cause of hot flashes and thyroid and all that. You want to optimize your digestion. So what do you need to do to optimize your digestion? And take notes here because there's a lot of good stuff here. Assess. Well, you've already done it with this assessment that I gave you. Optimize it from top to bottom. So we want to look at upper GI. Do you have GERD symptoms like the reflux? Do you have burning in your stomach when you eat? Do you have low HCl? Stomach soothing protocols are important here. So look at your numbers. If it's above 10%, then I would recommend that you do some really cool stuff to soothe your stomach. Slippery elm, DGL licorice, chewing your food well. Those are all super important things. And then look at your leaky guts. So if you have a high score on the pancreas, small intestine, you likely have leaky gut. But we have a separate leaky gut repair program that we do in our digestive process, our digestive. I just gave you 2 of these of maybe 20 assessments that we have for different parts. Do you have candida or parasites? Sometimes you can tell that by an assessment, and sometimes you may need to do a stool test to determine that. SIBO protocols. There's SIBO questionnaires that you can take to see, do you get bloated right after you eat, no matter what you eat? Maybe you have some small intestinal bacterial overgrowth that needs to be addressed. And then there's specific diets to determine if you need it. I have a version of this specific carbohydrate diet, the FODMAP diet, that I've converted to take out some of the garbage food they had in there, like vermouth and wine. And I'm like, how does this fall into a diet that's meant to heal your gut? And I've created a really nice one and a really super nice protocol, and it's in our digestive healing program. Optimize your elimination and transit time. Important. You gotta get that food out of you within 24 hours, because if you keep it in, you're going to recycle the toxins. And then finally, really cleansing your liver and gallbladder, whatever that takes. And we have a mini liver gallbladder cleanse in our gut repair program, but we have one of our practitioners who does a really intense one where you drink the olive oil and you pass stones and all that. I don't recommend you do that on your own. Really good to be guided. So let's go back here. Everything we already talked about, assess and all that. I won't read it again. We're running out of time. But optimize your digestion and then look at you stabilizing your blood sugar. So stabilizing your blood sugar is not just about changing your diet. It's about having balanced nutrition, consistent movement, low stress, restful sleep, optimal timing and rhythm. So we really have to work on all of those to get your blood sugar to stabilize. And everybody's a little different. Some people, one bad night's sleep can cause your blood sugar to be out of balance. So you want to learn to test your foods and personalize your menu. We did a little bit of that in the Fasting with Food. I just said, get a keto mojo and here's that. But there are some specific ways to analyze it and specific ways to test it. And we have charts and things like that in our Sweet Spot program. Those of you who have been through it. Keep your blood sugars in a safe range. Establish balancing lifestyle habits, right? You want to establish those and stick with them day after day. And then do a 30-day metabolic reset. What's that? Well, that's where for 30 days, you're only eating the foods that keep your sugar in the safe range. You're exercising, you're doing the stress management, you're sleeping, you're doing all the things that you need to do for 30 days. And it magically resets your insulin receptors so that some of the good foods that you had to remove, I had to remove pineapple and all the sweet fruits, maybe I can insert back and we test it. There's a process for testing it. You also need to, after the stabilizing the blood sugar, support your adrenals. We're all under stress, guys. We're all under stress. There's like tigers chasing us 24/7. Now's the holidays and people are getting into, like, I got to decorate and I got to make food and I got to shop for presents. And it gets us stressed. And your adrenals take the brunt of it. So we need to create a supportive lifestyle for yourself so that your adrenals stay protected. So I want you to do is, you did the assessment. If there's lab tests needed, like a Dutch test or a saliva test, run those to see what exactly is going on, but you can do other processes before you run the labs. Learn stress transformation strategies. I taught you one a little bit earlier. There's lots of others. We go through that in our adrenal program. Learn to make foods and use herbs and nutrients that restore your balance. And knowing which foods hurt the adrenals, which foods stimulate them, which foods help them to repair. Vitamin C, for example, super important. Vitamin B5, super important for your adrenal balance. And then do a 30-day adrenal reboot. Are you getting the picture? I like 30-day reboots because when you do a full 30 days of something, you really, really, really get a lot of traction in restoring balance. So now we're going to go to, after support your adrenals, restore your thyroid function. See, we didn't start with restore your thyroid function. Even if you are cold and your eyebrows are falling out and your hair is falling out and you're tired, we got to restore a thyroid balance, but we have to do it in conjunction with or after we've restored those other things. So appropriate testing and interpretation. You did your paper pen. A standard lab test that the doctors do is seriously lacking in thyroid. They only test TSH, which is actually a pituitary hormone. They don't test T4. They don't test free T4. They don't test T3. They don't test free T3. Most importantly, they did not testing and cleanse was Balance Your Body blueprint. And we're basically, had people get their tests done, and I taught them what the different pieces mean. I taught them what to test. And we were on a call and people were saying, oh, I got this back. And somebody came on and practically in tears, she goes, I have been struggling with my thyroid and with anemia and exhaustion for 15 years. I've been on thyroid medication. They put me on iron supplements and nothing is helping. And nobody ever tested for antibodies. She says, I looked, my antibodies are through the roof. And the big problem has been Hashimoto's all along. And she was crying. She says, thank you for helping me to figure this out. And then she was able to put a Hashimoto's type protocol, which includes a lot of thyroid and detox and stress management to do an autoimmune protocol. So protected from harm, there's a lot of things that hurt it, a lot of chemicals, a lot of your cosmetics, a lot of the air fresheners, and knowing that, and a lot of medications as well. So looking at the medications and knowing if they are problematic. You can do a lot of research on this all on the internet, or you could join our thyroid program and we give you the papers for you. Incorporate thyroid balancing foods and nutrients. And there's a bunch of them. And then do a 30-day thyroid reset, right? So you can see we've had 4 30-day resets, right? So 4 months, but there's time in between where you're getting ready for those. So really 8-month process to go through and really go through your body in a systematic way. And what you want to do before you get to that 8-month process of each system is to address those other things that we talked about, the stress and the pillars, right? The stress and the fun and the food allergies and all those things we talked about at the beginning. So all of these things are critical for you to feel better and to get everything in balance. And there may be a bunch of you that have been struggling for a long time and you're looking going, well, I never did this and I never did that. There are a lot of missing pieces. And wouldn't it be nice to have somebody who could help you to identify them and get that done? So I broke it down to the top 3 strategies to feel better now and avoid being tired, overwhelmed, and heading for long-term health issues, right? And a lot of you are tired and overwhelmed right now. Some of you are brain fogged. Some of you are concerned, and some of you are already on the path to long-term health issues with, numbers in the lipids panels and stuff that are out of balance. So eat clean and green. It's super important. Food is the basis of your body. It creates your cells. Eat clean and green. Do regular fasting and cleansing. And I put fasting in quotes because it's either water fasting, juice fasting, fasting with food, whatever works for you. And then live in an attitude of gratitude. And let me tell you, this is one of the key things for health all along. I know people who everything little that goes wrong, they're all rah, 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 rah. And other people who big things go wrong and they're thankful for the opportunity to move through it and thankful that they're able to get through it. So you can choose. These are choices. You have choices. You always have choices. And you just have to take the first step, and then the next step is easier, and then the next step's easier. And sometimes we look at the staircase or the mountain as insurmountable because it's high and there's a lot of steps along the way. Just take the first step and then be guided to take the next step. And I think the fact that you're here says you took the first step. The fact that you participated in the Fasting with Food Challenge, you took the first step. Evaluating your health status is a critical first step. If you did the forms, congratulations. If you didn't, do them. You've taken that first step. If you don't know where you are, you don't know how to plan the road to where you truly want to be. And if you're like most people, health and happiness are top priorities, right? That's what we're here for, to be healthy and happy and to be able to spread happiness to those we love and to everybody in our environment. So you have a choice, right? You can get off at the exit for the old you and continue the habits. And maybe some of them are really good habits, which are great to continue, but there's some things out of balance there. And maybe you want to go out the new you path, right? And so the new you, on the new you path, you're bringing your body into balance. This is not a medical term, body balance. Like my very first program that I did was, it's interesting, we're coming back full circle, is Body Balance Blueprint, right? And so body balance is all about you identifying and then correcting the imbalances in your body. So I said everything's a choice, right? At this point, you could just cross your fingers and hope. Keep doing what you've been doing. Keep doing the summits and programs and whatever else you're doing on your own, reading books and not really getting the answer. You can also just become Einstein and learn it all on your own. There's a lot to learn. You've probably been reading books and going to summits and you still haven't figured out the solution to your particular health challenge. Or you can choose to get support and have accountability and learn it in an environment where someone else is holding your hand and taking you through. And now it's a choice, door number 1, door number 2, or number 3. So I want to move into telling you, if this all resonated with you and you're feeling like, wow, that's a lot, how am I going to do all that? I rest assured you don't have to do it alone. And I can share with you and I can take you under my wing and we can do this together. And we can take you through all of those pieces, those steps that are appropriate for you. Not necessarily all those steps. But you see, you're going to try to do all those steps if you try to do it on your own. And we're going to try to help you to support you there. I want your energy tank full. When your energy tank is full, you are contributing in the world. You are happy. You are healthy. You are so good. And when it's on empty, you're wasting your amazing potential. So that's why I created a program that I'm calling Body Balance. Appropriately so, because bringing your body into balance is critical for you to be healthy. So I'm going to share with you how you can become part of this community, what's involved in the community. It's basically a program where you're going to get my support and support of some of my coaches who've been trained by me for 9 full months. Remember we said that there's those 30-day resets and there's the work in between. And ideally that's an 8-month process and then a month process to do the food eliminations. It's a 9-month process and we're going to guide you through. It's almost like gestating a baby, right? And a new you is going to be birthed at the end of that if you're able to follow through. And we're going to support you to help you to follow through. So it's a virtual online program. There's a membership site where you get to watch videos and we'll guide you through watching the videos and checklists and recipe guides and all the things you need to go through those steps I just outlined to get your body in balance. And then there's community calls and support, and that's a group. So the Fasting with Food Success formula, everything from assess your body systems down to regular cleanses is in a module we call Empower Your Inner Healer. We're going to take you through assessments, the ones you did before and others. We're going to give you the forms to keep track of them. We have a really cool form where you can put them in and the cells change color and you'll get to track your progress with the forms. And guess what? The forms are free. So you can track your progress every month to see where you need to do tweaks. And we'll help you with that. You're going to connect to your why. We have a whole process for doing that. You're going to transform your stress. We're going to teach you the processes. We're going to teach you some strategies for drinking your water, for making sure you have a schedule. We're going to give you the data behind why you need to get out in the sun and give you some ideas. We're going to give you some data on going to bed and some strategies to fall asleep if you're having trouble or to stay asleep. And point you to maybe you have an adrenal issue that we do need to get some testing to see what's going on. All of that we're going to get you started in this Empower Your Inner Healer section. And you get moving, you're going to green it up. We're going to give you recipes and guides for how to do that. We have some videos on the movement piece. We're going to help you to reduce your toxic load. We have a whole section on that and checklists so you can do inventories in your home. You're going to do an elimination diet, schedule the regular cleanses. So all of that is included in this Empower Your Inner Healer. This is not like we just slap it on you. This is stuff where we're going to guide you through it, okay? So we have emails to take you through it. We have calls throughout the month to help you put it in place. Some people take about a month to do this. Some people take longer, and that's okay. However long it takes you, you get to do it, and you get to get the support that we're offering for you. Then we're going to help you to optimize your digestion. You're actually going to get my full gut repair program. Balance your blood sugar. You're actually going to get the full blood sugar balancing program. Support your adrenals. You're going to get the full adrenal program and the thyroid. So I really recommend that you stay to the end of this because you're going to learn more as we do that. And I'm also going to give you access to that amazing lab, the sheet that I showed you earlier when you stay here. So Empower Your Inner Healer, like I said, there's all of these pieces. You're going to do all of these pieces, and we're going to guide you through that. We're going to give you support. Our community support is amazing. We have a Facebook group, and you can put questions out there, and either one of the coaches or me or some of the other people in the program are going to answer them. We're going to give you access to monthly calls with me or one of my coaches. Most of the time, they're me. This might be the last year that they're all mostly me because next year, 2021, I'm phasing out of that so I can work more on the side of teaching my practitioners, and some of these amazing practitioners are going to take them over. But if you're really wanting to have me in it, this might be your last time to get me on a regular basis. So let me tell you more about what we're giving you. So you have the Optimize Your Digestion module. All those things I said you needed, all those things we have. We have protocols, we have assessments, we have all these amazing things to help you get there. We have nutrient assessments in here so that you know if your digestion is impairing your nutrient absorption. And we're going to take you through all of these pieces step by step so it's not overwhelming, right? We have modules, and then we have these units within the modules that step by step we take you through the digestion. In the blood sugar, we're going to give you that 30-day personalized metabolic reset. We're going to teach you how to figure it out for yourself. We're going to teach you how to test your blood sugar, how to track your blood sugar. You'll have videos to learn how to interpret it. We're going to give you 30 days of menu plans, 250 pages of recipes, and home testing trainings. All of this is included in this program. And that's my sweet spot program, basically. Support your adrenals. It's our correcting adrenal fatigue and exhaustion program. You're going to get the entirety of it. The assessments and lab interpretation guidance. We're going to help you with the transformation of your stress. We're going to give you this amazing guide to herbs. And so you're not just like, oh, I heard this on this summit, I'm going to buy this. I'm going to heard this on this summit, I'm going to buy that. You're going to actually help you. Those are going to help you. And then you can come to calls and ask to make it personal to you. And then you're going to get the 30-day adrenal reboot. And with the thyroid, that testing is amazing. By the time people finish going through this, most of them know better than most medical doctors how to interpret a thyroid test. We're going to teach you how to do it. So we're not just taking you through this, we're giving you tools that you can have for the rest of your life, because you need to be empowered, because the doctors aren't doing it. They're not doing it. We're going to give you all the thyroid balancing foods, the chart of all the medications, all of this stuff is included, and then a 30-day thyroid reset. So as a summary of what's included, you're getting self-paced, downloadable online training so you can go through them at your own pace. You're going to get Empower Your Inner Healer, Optimize Digestion and Detox, Stabilize Blood Sugar, Repair and Rebuild Your Adrenals, and Restore Your Thyroid Function. All of these are the modules in the program. They sell on our website, except for number one. We've never sold that other than including it here. But if we were, we'd probably sell it for around $500. These other programs sell for these prices on our website right now if you were to buy them individually. So the total value of all those programs is $3,375 if you were to go to my website and buy them individually. Take away the $500 for the inner healer because you can't buy that. So the 4 of them, it would be like $2,900. Okay, those are included in this program. And you're going to get amazing support. 9 months of group mentoring sessions, and those are online. You get personalized questions to be asked. You can ask me questions. We go around the group. We usually anybody that has questions comes in and asks. And then 9 months of online community coaching, right? But I wanted to give you more than that because some people just need more connection. And so what we're doing, let me go through that next. So all of this plus the personalized coaching, those calls, the total value is now in the 5,000 range. But we're not going to charge you that. I'm not going to charge you half of that. I'm not going to even charge you half of that. I'll show you in a minute how we've made this affordable. The support, again, you get the 9 months of mentoring. You get the Health on Demand community, which people are active in. Then you get some quick action bonuses. And I'm going to give you, and we're going to give everybody that signs up by the end of the year these 2 bonuses. Okay, so you have to sign up by December 31st to get them. But I want you to sign up sooner because you'll get immediate access. And I have a couple of other bonuses that you'll get if you sign up sooner. I want to know who's in. And I'll tell you why in a minute. You get 9 monthly group implementation calls. That's with me leading. I usually have a topic we're talking about. If it's digestion, blood sugar, some of the Empower Your Inner Healers, elimination diet, we're going to guide you through that. And then, and you get to ask any questions. You can just say, I just got my stool test back and it says I have 4+ Klebsiella. What does that mean? Okay, I'm going to share with you. They're all on Zoom. We can share screens. We can see each other. You're going to get 9 monthly group integration calls. These are small groups. We're going to break the group into, depending on how many people we end up with. This last year, we had 6 groups, and we had a coach that guided all 6 groups. This time, we may have 2 coaches, depending on how many groups we end up with. I need to know by the end of the year so that we can get these groups set up. These groups usually meet in the 3rd week of the month. The group implementations are usually the 1st week in the month. The group mentoring ones are usually the 2nd week in the month. The small groups are the 3rd week in the month. And the 4th week of the month, you get to work on things on your own and then come back and come in for the following month. That's how it usually works. So I need to know so I can create these groups. If anybody that signs up after that, there may not be room in the groups. I may not have made enough of the groups. So I want you to sign up by December 31st to get those. So you've got the self-paced modules, all of those. You've got the coaching, the 9 months of body balance. You've got the 9 months of on-demand Facebook group. You've also got a quick action bonus with the monthly implementation, the monthly integration, and the total value of all of that comes out to be $6,900. But like I said, again, you're not going to pay that much. I promise you. The everyday investment we put up for this is $19.97. It's an amazing steal. And I'm going to actually make it easier on you than that. It's the holiday season. I want everybody to be able to do this. I want you to be able to say, instead of, I can't afford it, like, oh, my health is worth it. I can do this. I can do this. Because whatever you're doing right now may not be working for you. Now, some of you are on here, not eligible to be in here. You're already in my Energy Recharge Inner Circle. So don't sign up because this is already included in that. And that's our year-long program. Those of you in NEPT, don't sign up. You already have access to it, okay? But those of you who are not in those programs, please, take advantage of this opportunity because it's amazing. And let me tell you, before I tell you the actual investment that you're going to do, I just want to tell you about 6 additional bonuses that everybody gets. One is called the Save On Supplements System. And let me tell you this. Most people I know are taking way too many supplements. Some of the supplements they're taking aren't getting absorbed because they're substandard. What I put together is a system of all my supplements that I like, that I use, the brands, the different types that you can actually use and get access to. And it's a beautiful document, and we keep it up to date. We'll update it every few months, and it's a value of $97. You get it absolutely free when you join this program today. The other bonus that I put together, and this one I always debate whether I should give this out. This is a master tracker. And I put together an amazing tracker that lets you keep track of your own health. And I usually only give it away to the people in the inner circle in the year-long program and to the practitioners. But this has a page where you can keep track of all your labs. It changes color when your labs are out of the optimal range. So you can at a glance see the areas you need to work on. It's a really amazing program. And I don't even know what I would sell it for. I just threw a number out there, but at least $300. I wouldn't let it go for less than that, but it's going to be included in this program. The other thing I'm offering you is number 3, which is a lab test interpretation guide. This is priceless. This is going to teach you about what the labs are that in the standard blood chemistry that your doctor may be running already on you. And it's going to teach you how to interpret that and how to ask for the right tests. So it's free today, included. I got 2 more. The Insider's Guide to the Ultimate Food Prep Devices. Oh my God, this is amazing. This is all the different tools that I use in my kitchen with links. And, you know, it's just people are always asking me, well, where do you get that? And what's the best brand for this? So we put together a guide and you get to get this absolutely free with the program. And oh, there's 2 more. Guide to the Grab and Go. This is my favorite because I put together these strategies and menu plans for if you just want to make a bunch of stuff at the beginning of the week and be able to grab and go as you go through the week. This is priceless. This is what I do, and I absolutely love it. So I put together a guide for that, and free today. And then I have this really cool book of elixirs. We call it the Lift Your Libido Guide. And it's basically because so many, your libido is based on so many imbalances in the body. This guide has recipes. It has a chart of which herbs help to support which systems. And again, I'm not a this for that person, but it helps you to balance things by having this really cool tasting elixir every day. So those are the 6 bonuses. Those are included. They have a value of about $782 if I were to price them and put them on the website and sell them separately. So you are going to get all of this today when you join us for Body Balance and the big reveal. Instead of $7,000, instead of $5,000 or $10,000 or $15,000 like our people in our ERC Inner Circle pay, you get to do all of this for just $197 a month. But you have to go to this site and you have to use this promo code BBF50, lowercase BBF50, Body Balance. And I think my team will put up a link so that you can do it right away. You can just click it. Nope, no, they didn't. I'll do it myself. Okay, there we go. So you can just click it. It should show up on your screen. This is an amazing opportunity for you to get all the support you need to finally feel better, right? It's not working to do just the free stuff. Maybe it's working too slowly. I want to know how long, and I'm going to look at that in a moment. How long have you had these issues? If you've had issues, the same issues for more than 3 years, you're not on the right track. There's something missing. You need to get support to get it done. I wish you could just do it on your own. And my goal is that when you finish this program, that you know enough to do it on your own. So I have one more thing. So everybody that registers by the end of the week, which would be tonight, or well, let's just say the week is Sunday, right? If you register by Sunday night, you get lifetime access to that cleanse I was telling you about, the Body Freedom Cleanse. We called it the Green Cleanse. It's being rebranded to the Body Freedom Cleanse. And you get lifetime access to that, to all the recipes, to the menu plans, to the guidance where you can actually sign it up and on your own get messages every day to guide you through. Amazing program. We've had hundreds and hundreds of people go through it, probably over 1,000 by now. And they've had amazing results. And you get it absolutely free when you register by Sunday night. So that's like 48 hours from now. Okay. So a summary, you get all of those modules that, are individual programs that we have sold over the years for those prices. the group mentoring sessions every month, the on-demand coaching, and the community online. You've got the monthly implementation calls where you've got me going through and teaching you how to implement these things. Sometimes it might be one of my coaches, but mostly me. Then you've got one of my coaches who leads a small group integration call every month. So these are 3 amazing opportunities every single month that you get to come to calls to get your program personalized. And all of this is just $197 a month. And make sure you use the promo code BBF500, BBF500. All right. Now, I've got a couple more things to share. People say, well, I can't do this on my own. And can I really do this? And is group enough? Well, we're going to offer you, if you register today, by the end of today, you will get access to a private health evaluation and planning appointment with one of our functional nutrition coaches. We're going to fill out a comprehensive health questionnaire, and they're going to sit down and really help you position yourself for success in this program and help you come up with a plan for how you're going to succeed. This is an invaluable opportunity. For $300 is what we would charge for it. Today, it's included if you register by the end of tonight, So all of that coming together again, you getting all of this support, all of this education, all of this community, plus private coaching for just $197 a month. So go to bodybalanceformula.com, bodybalanceformula.com, and get signed up. Get signed up right away, because I'm going to give you one more bonus if you sign up before the end of this. But I want to do a little bit of teaching right now on lab testing. So I want you to really think about what your health issues are costing you. How much have you spent in supplements? How much have you spent in doctor visits, copays, whatever? How much have you spent on lab testing? How much have you spent on summits and all kinds of online things to try to get your health back? This is going to be a program where you went for 9 months. Guaranteed you didn't do anything for 9 straight months, most likely. Where you have the support, where you've got a mentor, where you've got a whole team of people helping you to get better. So I would say that it's cost you a lot of money, probably more than $197 a month if you averaged it out. And a lot of heartache, a lot of pain, a lot of suffering, and a lot of loss of relationships. So blood testing is one of my passions. And we have access to a blood chemistry software where you can give us your latest labs from your doctor, or if you prefer and you're in the States, we can show you how to get some specific testing done. And we're going to run it through this. So we run things through the software. I'm going to give you offer you one more bonus to get you the ability to get your stuff run through this software. Not everybody's getting this. It's a bonus, and it's a before the end of this call bonus. So you must sign up before the end of the call. This program will show you where you are in the optimal range, and it graphically shows you and gives you the numbers. It will also show, these are really cool things, how your blood tests compare. So we'll actually, if you are one of the ones that sign up before the end of the call, we'll actually let you have 2 of them. So if you have 2 old lab tests, we'll have you do it, and you can see how you're comparing. We also gives you this health improvement plan, and it's evaluated, and I'll show you some of the other ways it gets the details. Like what's out of balance? You have a high probability of metabolic syndrome, of DHEA need, vitamin D need, all of this from this basic lab test. And it'll show you this on the scale, right? It'll show you how you rate, and it's very graphic. Are you low or high? Are you within normal range out here? Are you within optimal range here? And it has this whole section. This is just a little snippet of it on macronutrients. Your nutrients, are they out of balance? Are they in balance? So vitamins, minerals, carbohydrates, and it goes, wow, there's a high probability of vitamins being out of balance. And then it will go and show you which. And underneath, this is telling you why it thinks that, and it tells you the lab results that you had that are contributing to that. This is so cool. You know, it has all the nutrients and what's out of balance for you, what seems to be. And you can't say 100% on some of them, but What are you leaning towards? This is such an invaluable test. So before the end today, if you register before the end of this call, we're going to give you the computerized lab analysis, which we would charge $225 for. And we're going to give it to you with 2. You can go back 1 or 2. Plus, I am going to actually personally sit down and review it for you. I've been doing this for 27 years. I can see things at a glance. I can explain to you what this means and where you need to be focusing yourself in the program and with the program resources to get the support you need. This is twofold. One, you're going to also fill out that questionnaire. So I'm going to know your health history too. This helps me to get to know you at the beginning of the program so that I can support you best throughout the program. I don't usually do these. I usually have my team do these. But I decided that I wanted to do it for those people who would take quick action. This bonus goes away after we hang up from this. If you don't sign up before we hang up, this goes away. Okay, so please, do yourself a favor. This is an amazing bonus. I don't even know what I would charge for my private time because I don't even give it away anymore. I usually have time with people who have signed up for big programs at a big expense. But it's at least a $775 value to sit with me, and maybe more, because I can go through and I can hone in and give you some really good analysis of what's going on. But only if you sign up before we end this call. Okay, so if we add this all up, the total value is really, if you get in on before the end of the call, is over $9,000. And we're going to give it to you for just $197 a month. $197 a month for your health think about some of the things you spend your money on throughout the month that are not gearing towards your health. This is you. This is your life. This is your life of your family. This is the health of your family. This is stuff that you need to be focused on. So I want you to be sitting at the top of the mountain and looking out there. I want you to be, whatever your goal is, whatever your goal is, to have the ability, the strength, the stamina to live your life to its fullest. So in addition, there's a $197 a month. If you decide when you get to the page that you'd rather just invest in the whole thing up front, it'll tell you how to do that. And we're going to give you 2 additional bonuses. One is a 1-year membership in our Vital Premium community. And that includes access to the complete library of 8.5 years worth of monthly recipe digital videos, PDF recipe guides, health topic recordings, and monthly support calls, plus the live monthly calls, 3 live monthly calls, our Vital Kitchen, our health topic, and a Q&A call. So honestly, you're getting 4 times a month of Q&A calls when you do this, when you invest in full, because the Vital has that one additional. So every week of the month, you're going to be able to get support for wherever you are on your journey and whatever questions you have and need answered. So I highly recommend you consider it. The other one is, while the program includes access to the self-study version of the Sweet Spot program, we're going to be doing it again live in 2020, starting in April. And you're going to get access to all the live calls and all the bonuses we offer for that. Normally, the value is $497. We usually do a slightly discounted rate for people in Body Balance, but you're going to get it absolutely free when you invest in full. You have to get these invest in full bonuses, you need to be registered by the end of Sunday night. Okay, that's when those bonuses go away. Sunday night. Okay, so Sunday night is when that goes away. The coupon code we will keep active until, we're going to be very kind to you, we will keep the coupon code available until the end of the year. But the bonuses are going away. So you'll still get your $500 off if you decide to register next Monday or Tuesday or Wednesday. But you just won't get all these extra bonuses. And I'll recap what those bonuses are. Okay, so you're saving $276 when you invest in full. And just use that BBF 500 and choose the invest in full option when you get to bodybalanceformula.com. So a lot of folks will come up and say, I can't afford this, or it's not the right time. And I'm going to ask you to challenge yourself when you do this. What is it that you're choosing over your health? What is it that you're choosing over your health? Because your health is your most valuable asset. And I don't want you to exchange what you want most for what you want in the moment. So I highly encourage you to join us for this program. It's going to be an amazing ride. I can't wait to get to know you and to be able to dig my heels into helping you to get beyond whatever it is that's going wrong for you. All right. So the quick summary, all of this stuff is in the program, the standard part of the program, the Empower Your Inner Healer, the Optimize Your Digestion, Stabilize Blood Sugar, Repair and Rebuild Adrenals, Restore Your Thyroid Function, plus the 9 months of group mentoring sessions and the 9 months of on-demand health coaching in the community, the Facebook community. The quick action bonuses, monthly implementation calls, the monthly group calls, those are going through December 31st. Because we're starting again in a new year and because I'm being generous with this, I'll let that go. Plus the discount of $500 will be till the end of the year. But and the implementation bonuses are there too. But these extra bonuses, the Body Freedom Cleanse Lifetime Access, that one's until the end of this Sunday night. The first, this is not the first 24, it's in anybody that registers by the end of today. Was the Body Balance consultation with your coach. And then the super quick action bonus ends at the end of today. So the super quick action bonus consultation with me with your computerized blood chem is the end of this call. So that goes away. The coaching with my coaches, that goes away at the end of tonight. And then the Body Freedom Lifetime Access and the full pay bonuses, the Vital and the Sweet Spot, those go away at the end of Sunday. So it's really important for you to take action now. Take action now. Your health is your most valuable asset. We're going to get started in January. Our first call will be the first week in January, our first implementation call. We'll orient you, we'll get you started, and it's going to be an amazing ride. And it's just totally going to be an amazing ride. So bodybalanceformula.com, $197 a month. So I'll answer any questions. I'll stay on for a little bit. I want you to know what's included again. That's it. So you stayed until the end and you get rewarded. Go to drritamarie.com/labgift and we will give you that handout, that beautiful handout that gives you all the different ways that you can assess the various body systems. drritamarie.com/labgift. So I'm so excited that you came to this webinar. I hope you learned a tremendous amount because there was a lot to learn. If you're feeling a sense of, wow, I learned a lot today, but there's a lot to learn and I don't know how I can do all that, that's where making a decision to join us for the bodybalanceformula.com, for the Body Balance program, be part of the community, be part of that circle that I spend a lot of time with, that I get to know a lot. And I can't wait to get to know you. So go to Body Balance Formula. You can choose the $197 a month. Always make sure you put BBF 500 in there. And then if you decide that you're going to do the invest in full, which actually, quite frankly, most people do because of the bonuses and because of the savings, then you're going to get the 2 extra save things, which is the Vital for a year. And you're going to get the Sweet Spot. You're going to get taken through the Sweet Spot for free and get all the bonuses and extra live calls for that. So I'm going to stop my share. And I'm going to check questions. I know some of you dropped off. I went over. I apologize it. I'm looking at some of the problems you guys have been having. You know, Anne says fasting 36 hours a week and no weight loss. Poor memory from Patty and low energy. And Jay, diabetic and having energy problems. All of this stuff we can address. All of this stuff we can address with Body Balance. I don't guarantee cures, you know. We have to look to see what's going on. But I mean, we've had people who turn their diabetes around in as little as 2 weeks and sometimes a little more. We talked about Tom and his prostate. Heather, insulin resistance. Yep, you did great with the fasting with food. Net, I want to be consistent in time of day that I eat and going to bed early. Awesome. That you need, what do you need for that? Think about what you need for that. Do you need accountability? That's what we do a lot, where you make a commitment on a call and then post it to the group and commit to the group. Kathleen says she tends to form stones that accumulate in the common bile duct. I had my gallbladder removed. Oh, I'm so sorry. So going through that digestive piece and the gallbladder cleanse in there is a really good place to go. Ross said, want to find a fasting strategy that's more workable. Do clear broth fasting with leafy greens, but it gives me kidney pains. All right. So, it's looking at what's your imbalances there and what can we do to support you there. Rob, hi all from Northern California, challenges discipline to exercise, cravings, and low thyroid. Yeah. So this can really help you a lot, Rob. Getting that discipline and helping you to have that and giving you the accountability. I tend to be kind, but tough in a way of like really holding people accountable and finding where there's some limitations and limiting beliefs. Reba from Arizona, my main concern is the growing goiters. Oh no, that keep growing, have them biopsy and they're negative, but concerned about them, had them for over 15 years. Did you ever have antibody testing, Reba? And have you had your iodine tested? There's some stuff we need to look at for that and see what those imbalances are. Do you have thyroid hurting things in your environment and food? Daharami, insulin resistance and overweight. That's an easy one. We do a lot of work with that. Fasting has been the only way I've been able to lose weight for years. From Chris. Yeah, it's a matter of getting you on that right diet for yourself. Leanne, struggling with food for a while, tried a few things, still working at it. I first started with Dr. Furman in 2014, then came across Food Revolution, part of that for 3 years, became vegetarian, and after a year now vegan, not able to lose the weight I want to lose. It's a balance thing, and it's likely there might be some insulin resistance, and you need to be learning how to teach your body how to burn fat. Claudia from Scottsdale, want to bless my blood sugar levels. Okay, blood sugars, we have such great results with blood sugar. Peggy, the last 10 pounds. Sometimes that last 10 pounds is in the blood sugar. Sometimes it's in the microbiome. It's looking at that. Meg from Bremerton, optimal health and energy. Yes. Energy and right abdominal firmer than left. CT scan showed nothing. So I don't know about that one. Lynn, dealing with a lot of oral health that are causing challenges with insulin. Yes, that's got to be addressed. Kathy, I do have intermittent fasted 268 days with absolutely no change. So it's a matter of looking to see where the imbalance lies, Kathy. Leslie from Hamilton, Ontario, I want to keep my blood sugars balanced as well as my glucose and cortisol, family history of diabetes, still going through menopause. Okay. So all of this stuff is, it's approachable from the standpoint of why? Why are you having these issues and what can be done about it? Nancy, treated with radioactive iodine for hyperthyroid. Now you're on thyroid medication, probably. Gained 25 pounds, only eat a certain, so that's an issue. It's really looking at what is there. Maybe there's specific nutrients you're out of balance with, maybe specific herbs, and maybe there's a digestive issue that didn't get addressed. Carol missed the 5-day challenge, change over a clean organic diet last year, started to do some intermittent water fasting, recently diagnosed with, I'm so sorry, breast cancer, gathering data. That the cancer can be caused by so many things, gut issues, immune system issues, lack of nutrients, too many nutrients. Iodine tends to be one. Some people get good results with rubbing iodine on the breasts to help that the iodine, there's so many things in the environment that impact. Dr. What's the one that talks about, Brownstein talks a lot about that. MD took me off hormone meds, gained plumpness below the waist. It depends on what those hormones are, but it's really looking at why did you need the hormone meds? I mean, if you had a hysterectomy or something removed, you're going to have to replace them, but it's a matter of finding the right balance. Lower cholesterol, already on a high fiber vegetarian diet. Judy, I'd be looking at low glycemic, because if high fiber vegetarian diet, a lot of people still don't lower their cholesterol when they're still eating a lot of the grains. Lots of allergies, difficulty losing weight, tummy. Yep, that's often it's a adrenal and blood sugar issue, right? You've got to get the cortisol levels under control, and you've got to get the um, blood sugar balanced. Anne says getting to the root cause is what I want. Absolutely, Anne. We need to get to the root cause, and it's a strategy for digging deep. And when you're in a program like this, you have the opportunity to spend a lot of time and get education about it versus go to the doctor. They say, that didn't work. Here, try this. That didn't work. Here, try this. Christy, we talked about your assessments. Anne has some stuff in the digestion, 17 out of 17. Yeah. So large intestine, small intestine, and adrenals. Adrenals look like the largest, but you need to work on the intestinal stuff. If you have intestinal permeability, that's going to affect your adrenals. And if you have overgrowth of something. Heather, liver and gallbladder digestion, hormone is low, thyroid. Okay. Peggy, large intestine, small intestine, pancreas. So I would recommend that, definitely, Peggy, you got to work on your digestion. It's clear. Chris, gallbladder is number one. Gallbladder removed, so that's where you're going to get it. So supporting, we have a whole section in the digestive piece on what do you do without a gallbladder. How do you prevent your gallbladder from getting removed? But then we have what if your gallbladder is already removed? What are some of the things you have to do? Intestines and pancreas. Sulfur foods like broccoli and onions burn my throat and guts. Low stomach acid. So that's where you would eliminate those foods for a while, and then we need to work on cleaning up the gut. Clearly, if you had your gallbladder removed and you tend to form stones, there's an imbalance there. So we want to figure out what that is. Mary Kay, postmenopausal symptoms, okay, 42%, immune system 33%, hypothyroid, struggle with mood, sadness, weight loss. So I don't know what your gut numbers were, but if there's anything in your gut, you need to make sure that before you just jump in and start to address the menopausal, it might be caused by gut, even though the gut might not be showing as high. So I would be looking at that for you. Flow, a lot of postmenopausal thyroid and small intestine. In your case, again, I would make sure that you're addressing the small intestine. There are herbs and things like that you can do for temporarily, like symptom relief. But you've got to get the gut and the thyroid balanced, or else that'll just be symptom relief. Chris, low thyroid. Tried thyroid made me extra stressed, so adrenals weren't strong enough for new. Take LDN, slowly helped. Insulin resistance, 44%. Do metabolic reset a few times a year and water feasting, fasting to get my glucose under 80, normally 90 to 110. Cortisol elevation, adrenal. Yeah, so complicated. There's a lot of things going on. So you've addressed the insulin resistance. I don't see where you've addressed the gut. There may be some gut issues there. And, really looking at all the stressors. Marilyn, thyroid low, adrenal, stomach acid, all of those are connected. So working on that gut to get the thyroid under control, and making sure you look at a full thyroid panel. Anybody that had thyroid, you want to look at a full thyroid panel, because if you just look at TSH, you're not going to get it right. So it could be a conversion issue in which you would address differently than if it's a low production and an iodine deficiency. So they're all very different. Cortisol 67. Wow. Glucose fluctuation 52. Adrenals general 37. Female hormones. Okay. Again, I would look at what your gut is and start to work on that, and work on the stress piece. The transforming stress pieces is going to be super important. That's super important for your gut as well. What is manipulative correction? Please repeat the scoring. I think I missed something. I don't even know if Gloria is still there. What is manipulative correction? That would be like a chiropractic adjustment or a physical therapy where you're manipulating the spine, is what I mean. Think you mean. Jay, what is the best time span of non-eating for weight loss during intermittent fasting? I always find that the non-eating 16 hours, but if it's too hard for you, start with 12, go to 13, go to 14, and bring it up. Pam from Arizona, 70 years old, great. I wish to get a good exercise and begin a lifetime to build muscle and lose fat from waist to knee. Wish to learn what happens and wish to learn what causes age spots in seniors. Generally, age spots in seniors are a liver issue. It's a pigmentation thing that the liver is not clearing things very well. Daily eating plan during non-fasting days. Rachel, is more fruit allowed during the non-fasting days? Looks like Lynn and Angelica asked. You get to test to see how fruit works for you, absolutely, and find the fruits that work to keep your blood sugar steady. What's the difference between daily eating plans for fasting days and I would look for the fasting days and the non-fasting days. They're going to be similar in terms of foods. It's just going to be like on fasting days, you're just going to have that one meal. You're just going to have the dinner or the breakfast. Some people just do breakfast to breakfast. And it's going to be a solid, good eating day. And they're all going to be similar. It's just the amount that you're eating. Yeah, and the fasting with food documents covers that. Affexa labs, I'm not sure about. There's so many labs. They're not one of the ones I use on a regular basis. Barbara, the perpetual, what do you when you're on blood thinners? And Ned answered, Barbara, my ex was told if he was going to eat foods that thinned his blood, he needed to be consistent with the amount. The meds would be adjusted. You should check with your doctor. That is the perfect answer. Thank you, Annette, for that, is to say, look, this is how many greens I'm eating on a daily basis. Please adjust my blood thinners accordingly, and then be consistent. Why do people feel lightheaded? Some people do. I don't. But they feel lightheaded because the glucose is going down and they haven't fat adapted, so they're not burning ketones, so they're not getting very much energy to their brain. Can we get the images clear in emailed version? Hard to read. What does that mean, the image is clear? I don't know what that means. Program good, safe to do with the microbe formula detox. By the way, anybody we don't give out slides to these webinars. We just don't. We do give them in programs where people have invested to be with us, but we don't just give them to everybody. It's valuable information, and it's kind of proprietary information, some of it, and so we don't give out slides, but we will post slides in the group. So we can have a page that's on the bonus page. We can add this presentation when you join the program, and you can review the slides, and we'll give you the slides as well. Is it safe to do with the microbe formula detox program? Oh yeah, that's all those great supplements. Yes. Have the formula detox to begin and want to do your program. Oh yes, totally. Yes, you can totally okay to do that. Yes, those are good. They're very good products. Answered that. You're not going to get a copy of this presentation unless you join, because it's just, we just don't do that. It's too much work to, get our team to make it ready and send it out and all that. Will the bonuses be on the Body Balance Formula site? All 6 of the ones that are the implementation bonuses are there. And as soon as you get access today, you'll get access. We have a Unstoppable Health community website where you log in, and all of the programs that you have access to will be there. So it'll take a few days because we're not going to do it till we close the bonus period. So say you get access to the Green Cleanse as a bonus, then next week you'll see that show up on your dashboard and the other programs. So we don't do them right away, but we will give them. We'll give them quickly, pretty quickly. Yeah, but the site is actually, Body Balance is one of the programs within our Unstoppable. So let's see. Tammy Jew, I love the fasting with food 5-day challenge. Awesome. Everybody just do it, says Leanne. I agree. Best of health. That's where we'd like to be, to see and enjoy our only grandson. And that is, so much of what we do. We want to take care of ourselves. My mom did not expect that she was going to die that day. She went out and she did her gardening. She had her lunch. She usually took a nap in the afternoon. She went to lay down. My sister came over unexpectedly. She worked in the area. She ripped her nylons and was going to put them on back in the day. And she went in to mom. She said, it's easier to go home than going home. It's too far to go home and better than going to a store to buy some. I'll just go to mom's. And she went in and dad told her that mom was sleeping. And she quietly tiptoed in, and she went to go in her drawer, and she looked over, and she just said, something's wrong. She looked, and my mom just looked wrong. And she went over, and she was, blue lips, and mom, she tried to wake her up. They called an ambulance, but she was gone. She was gone. 56 years old. 56 years old. Unfortunately, it was on my birthday. So I'll never forget that, right? Every birthday is like, but we don't know, right? And we don't want to do that to our family members. There are imbalances in all of us. So I'm so dedicated to my health. I'm so dedicated to keeping myself and my body in balance. And that's what I want for you. So I want to welcome Rebecca and Pam. Great decision to join us. If you're on the fence, I ask you this: what matters most, right? What matters most? You see the integrity and the quality of our support here. If you're not sure, then just at the bottom of the page, there should be a little chat thing, and just put your name and your phone number and your email address there. And one of our coaches, we have at least 3 of them on the call right now, can reach out to you and answer your questions and help you to make a decision. If you're saying now's the right time, not the right time, when is the right time, right? When do you want to feel better? Do you want to feel better in 5 years, 2 years, 1 year? As soon as possible, right? I think it should be as soon as possible. For me, if I wasn't feeling well, I'd want to feel better as soon as possible. If you're thinking investment, there's no place else on the planet that you will get a program that has this level of support, where you're going to get together and get a small group, and you're going to get me on these calls, plus just the getting that blood chemistry analysis and a consultation with me and then one of my coaches to set you up for the program is worth, that alone is worth the cost of admission, as they say, because you're going to get a great start. It's like, if you add the value of those 2 bonuses up, it's over $1,000. So you're really just paying $400 to get a whole year of coaching. And that's only if you sign up before the end of the call. And the call with my coach is only till the end of the day. So make a decision. Just make a decision. $197 a month, and you're in, right? You don't have to pay the whole thing in advance, just $197 a month. And we're going to take care of you. And we're going to take care of you better than you've ever been taken care of before. So I honor you for being here. I thank you for being here. I would love to meet you in person, and really all those things that I want to help you to get through that. And when you do, you'll have a coach that has a group, you'll have me on the calls, and you're going to get your answers, right? We're going to help guide you to identify the imbalances for you and to identify the best program for you. So thank you for taking time out of your busy day. I so appreciate it. Last chance for getting the call with me and that blood chem analysis, because that's a bonus that I'm feeling generous because it's the holidays and I'm giving that away, but I normally don't. And my time is limited, which is why I'm limiting it to the end of the call. So if you want that, then go ahead and make that decision. All right. Thank you so much. Much love, many blessings. Wish you happy holidays. And I'm looking to see, where's the chat, just so I can see some answers. Yeah, I think all the questions are in there. There's a new one here. I see a new one. Let me see. Let me just look in my, it's easier to read them in here in my, new ones. Okay. Rebecca, Pam, Kathy, Ellen, and Susan, welcome. I can't wait to get to know you, and I can't wait to have our call. We will send you by Monday. We'll send you a link where you can get that scheduled. We'll make sure you get an email that tells you what to do. And you'll have to submit. We'll give you a form where you can just send us a PDF copy or upload it to your site. We'll figure that out. We'll get that out to you Monday. We'll have you get that. And I want to get these scheduled as soon as possible. I need to get these scheduled by the end of January at the latest, but really I'd like to do it by the end of December so that we can start fresh. And when you come to these calls, we've already met, and I will already know you, and I'll be able to hone in much better on our group calls. All right. So thank you. I'm looking to see if there's any other questions that have come in since. Thank you very much. Sent an email, left a voicemail for your staff, Susan. Thank you very much. Susan, if anybody's thinking of it and you're on the fence, just put the 197 down. If you meet with one of the coaches and determine that no, it's not right for you, you get a refund. We'll just void your charge. So just do that. I mean, if you're not sure 100%, talk to one of the people, okay? Talk to us and put it in that little, the box at the bottom of the Zopum page should say chat. Hopefully somebody activated that because it should say chat. It shouldn't say send an email. So if you've reached out to one of the team members and you make a decision, we will honor that. But you have to do it during this call, okay? Yeah. I'm on the chat. Okay, good, Len. And the Susan wants to pay on 2 credit cards. That's fine. Pay on the one and pay the 197 on the one, and we'll have one of the team members get back to you and finish that transaction. That's easy. Scott can do that easily. So just get it in there so that we have you recorded that you did it by the end of the call. And just do the 197. He'll contact you either today or whenever within the next couple of days, and then you can split it between 2 credit cards. That's not a problem. Not a problem at all. We do that all the time. We'll see if we get a replay who just got on. Yeah, so all these on the call bonuses are not going to count if you weren't here. We reward people for being here live. I understand when people can't. That's why we did 2 calls this week. But go ahead and just sign up and see. I mean, it's just do the 197 and get started because it's a really amazing. Yes. Yes. Okay. So Ed says full pay $14.97 with the BBF code, or $19.97 without the discount code after 12/31, or $197 for 9 months and the program good for a year. Program good for a year. Well, you're in for 9 months, but you'll have access for a year. Yeah. You'll have access to the site for a year. The coaching part goes for 9 months. Here's the thing. If you want to do full pay, but you need to like move things around on your credit cards, go ahead and just do the 197 right now and lock in your bonuses, and then reach out and say, hey, I'd like to full pay. And as long as you full pay before the next charge would be due, which would be what? Today's the 13th. Yeah. So if you do it by the 12th of January, you won't get that second charge, and we'll be able to just manipulate it and charge you for the rest of it. So if like you're tight strapped for cash right now, understand it's the holidays, just do the 197 now. And as long as you get that full pay in, we'll still honor the full pay, right? We'll still honor it as full pay. So you pay 197 today. You say, I really want to do full pay, but I don't have the cash, I don't have the money, or my credit card is maxed out. Then as long as you pay it before the 13th, the 12th, then we will honor that as full pay. Okay? And so we'll just adjust it. There won't be any finance charge. There won't be anything. It'll just go through. All right? Because I know that it's the holidays and sometimes our credit cards get maxed out. Huh. Susan, checkmark stays on a single payment. Won't let me change it. Yeah, refresh your page maybe. All right, Susan, make sure at the bottom of the page is a place to put your email address and phone number. So put that in there. And I don't even know your last name. So we have a lot of Susan, so I don't know who you are, but we'll make sure that you get honored as the full pay, as the credit, whatever you're doing, but as having done it by the end of the call. Okay. Let me look to see. All right. I think that's it. I don't see anything else. So if you're having any difficulties with the order form, if you're having any unsureties, put your name and email address and your phone number in there, and we'll get you there. Okay. Try clicking in on the 197 box. It should change. Just tried it. So, okay. So that was probably Scott. He's in as me. Somebody's in as me. All right, guys. Have a great rest of the day. Again, if you have any troubles, and having trouble getting it through, we're going to, timestamp it for, within the next 15, 20 minutes so that if you're having trouble and you're talking to somebody and you had the intention of signing up and you click through and you say, I can't get through, no worries. We will count that as having done it. Larry wants to know if you purchase one of the other programs, for example, is there an additional discount? Larry, we'd love to do that, but we've already discounted it so much. And you already had the benefit of the sweet spot, and you already had all the live calls for the sweet spot. So we honestly, we can't do that, right? It's already at rock bottom at this point. And really what you're paying for is so much support. The support alone without all those programs would be worth the price that we're charging. So I'd love to be able to honor that, but that's not something we can do because it's already way discounted. Okay. All right. So we're going to give you a half an hour to get in. We're going to give you half an hour because I know some of you are trying right now, and I don't want to, be the meanie that says, nope, you didn't make it. We'll give you half an hour, and, as long as your processing is through within the next half hour, then you're good to go. All right. Thank you guys so much. I really enjoy doing these presentations, and I love having a hungry audience for doing it. Bye now.